Zimbabwe has launched a massive cholera vaccination campaign in the capital, Harare. Around 1.4 million people will be immunized against the disease over the next few days. The vaccination drive is the latest effort in the fight against cholera that has left at least 49 people dead and infected another 9,000 in the most recent outbreak. CGTN's Farai Mwakutuya has more.
500,000 people will receive the oral vaccinations in Glenview and Budiriro between Wednesday and Sunday. Another 900,000 doses will be administered in other densely populated suburbs next week. Authorities claim to have gained ground on the deadly outbreak. No new deaths have been reported in over a week, and the rate of infections has slowed down. The new line of defense is giving added comfort to at-risk communities.
We feel safer because if we take this vaccine, then we won't get cholera for years to come.
The vaccine will help because not everyone is adhering. The vaccine will help because not everyone is adhering to the safety guidelines, especially children who may not always wash their hands after using the toilet or thoroughly wash food before eating it.
One dose of the vaccination will ward off the cholera-causing bacteria for a year. A second round of doses, which will be administered by December, will increase immunity to between 3 and 5 years.
The timing of the vaccinations couldn't be any better. They come just before the onset of the rainy season, which would ordinarily increase the risk of new infections. However, with their immunity and resilience bolstered, residents here will enter that season in less danger.
Other interventions should not be stopped, though.
We are in a good position today with the introduction of the vaccine. I think the nature of cholera, especially with the onset of the rainy season coming, and we know also as well that the sanitation system is quite fragile. We can't say we're out of the woods yet, for sure, but it is a good mitigating measure for the time being, and then those other efforts need to continue, if not accelerate, to ensure that we get on top of this and put an end to cholera.
Work to upgrade Harare's main water treatment facility is underway, and plans to develop 2 new dams to serve the capital's growing population are due to be revived. Government aims to raise $64 million to treat the current outbreak and to permanently solve Harare's water reticulation and sanitation problems. Farai Mwakutuya, CGTN, Harare, Zimbabwe.
Well, let's get the latest now on Zimbabwe's vaccination drive. CGTN's Farai Mwakutuya joins us live from Harare. Farai, of course, as you mentioned in your report, the rainy season is on its way and there are over 1 million people that need to be immunized. How is this campaign being coordinated?
Well, the campaign is being rolled out at community centers and facilities, particularly here in Budiriro and Glenview. I'm actually at the Budiriro Community Center where people are streaming in to receive those vaccinations. 500,000 will be administered between yesterday when it began and Sunday. Another 900,000 doses are expected, and they will continue to be rolled out here, but also in other densely populated suburbs in the capital, Harare, that face similar challenges to Glenview and Budiriro, water challenges, sewerage and reticulation, and it's all to try and build up the resilience against cholera, particularly ahead of the rainy season. It's being administered to everyone above the age of 1 year, and we know that a second round of doses is due to be administered before the end of the year, and that will then bolster the immunity and resilience for between 3 to 5 years, Lindy.
And of course, Farai, I imagine many Zimbabweans are still haunted by the memories of the 2008 cholera outbreak that left about 4,000 people dead. Is there confidence this time around that these types of efforts will help in avoiding such a high number of fatalities as seen in 2008?
Well, Lindy, I think certainly the response that we've seen so far, the speed at which authorities here in Zimbabwe, the government as well as the donor community have stepped up is to try and avert a disaster such as was witnessed in 2008. I think we're also seeing efforts to address the water situation. Water is being brought in for communities here in Glenview. Sewage pipes are being addressed. Rubbish that wasn't being collected is now being collected. And I think those efforts have helped to slow down the spread of the disease disease. Certainly, the number of new infections has come down, and the death toll has remained static for over a week now. So authorities are confident that they are winning the war and rolling back this outbreak. And I think the communities as well feel, much safer, as they were saying in that report, that, this vaccination will help them, will help other efforts, and will certainly supplement what's happening, and hopefully see them, free of the fears that they have of dying from this disease, which often recurs because of the poor sanitary situation. So it is a big boost what we're seeing happening here.
But we've also seen, Farai, that cholera seems to have become a bit of a political issue to some extent. I mean, just how much has this outbreak interrupted government's political program that's supposed to show the world a new Zimbabwe?
Well, I think it comes as a huge dent and a big challenge, certainly after, the inauguration of this new administration. They are having now to divert efforts and energies and resources that were meant for other things to fight this cholera outbreak. I think it brings back dark memories of 2008, when, the economic crisis was at its height, when elections were about to take place. And, this country was going through perhaps its the worst time in its history, economically and also socially. And so this will obviously, retard the efforts that the administration had to address those challenges. But I think it is also a test to show the resolve that the government has to bring long-term solutions to some of the social challenges, social service delivery challenges that Zimbabwe has suffered, and certainly that, President Emmerson Mnangagwa's administration has promised and vowed to address. How they respond to this emergency, how they are able to contain this outbreak, may actually be a stepping stone and a milestone that they can point to say, look, this is how quickly we're able to act. This is how we are different from the previous administration in terms of dealing with emergencies and challenges that are afflicting and affecting the people of our country, Lindy.
And indeed, this immunization drive certainly a step in the right direction. Thank you so much, Farai Mwakutuya, joining us there from Zimbabwe.